It's said to help with PTSD, seizures, pain relief, and even increase appetite. While medical marijuana is said to have several health benefits, it still remains illegal on the federal level.
Some people use it for just the satisfaction of curing something that hurts or there's something painful, but at the same time it is bad because you're killing your brain cells, you're killing a bunch of things, you're killing a future.
Despite being classified as a Schedule I drug, it's becoming more popular. 29 states now have legalized medical marijuana, and 9 states also approved it for recreation. The Washington County Substance Abuse Prevention Conference brought in local experts to give a scientific and statistical perspective. The main topic this year was marijuana. While CBD oil is already legal in Utah, voters could be deciding on whether to legalize medical marijuana this November.
At conferences like this, we're not telling people how they should think or how they should vote. We're presenting scientific information that comes from peer-reviewed sources, and we're telling people understand both sides of the issue so that you can make an educated decision.
Speaking before a crowd of educators, law enforcement, and others, Reed reported how THC potency of marijuana is also on the rise. He said marijuana can have several negative impacts when it is abused or overused.
Hospitalizations are increasing, motor vehicle crashes and fatalities are increasing, the number of people overdosing is going up, the number of people who are addicted and in treatment is increasing. And so we know that as perception of risk of the substance goes down, use rates go up, and all of those other social factors start following.
In states where marijuana has been legalized, the use of marijuana has increased substantially among youth.
There's a lot of myths and misinformation out there about what's happening with this substance and about the harms related to marijuana.
Sergeant Nick Hallman deals with drug interdiction. His studies find youth usually move on to harder drugs.
We've got our youth deciding that that gateway drug is no longer a risk. What is the chance of them getting exposed to something else? Because I'm honestly here to tell you, marijuana is a gateway drug, right?
I built a tolerance to it, and I didn't feel like it did anything anymore. And then that's what made me feel like, oh, it ain't enough. So then I was like, okay, let's kick it up.
Hallman said the latest trends are to package the marijuana into edibles to avoid the smell. But with edibles, the amounts can be deadly. Because of this, overdose deaths, poisonings, or accidental exposures to children have also gone up.
0 to 5 years, this isn't anybody making that choice or a medical problem. And really, these are accidental exposures.
Hallman reported that since Colorado legalized recreational marijuana, property and violent crimes have gone up, as well as homelessness. And illegal drug trafficking to other states is also on the rise. Some people believe that legalization of marijuana will help bring down the addiction of opioids. But data collected from several states shows this is a myth too.
Nationwide, our opioid overdose rates are going up, but it's an even higher spike in states that have legalized marijuana. So that argument just doesn't fly when you look at the data.
So why are we such a drug-addicted nation?
I mean, there's myriad reasons, but they all boil down to one, which is that drugs work. If you're stressed, they can help you relax. If you're depressed, they can make you feel better. If you're in pain, they can reduce or take away that pain. And I think that we've gotten to a point in society where we're a little too quick to turn to that.
Most people get their marijuana from others, not from a legalized source. Reed hopes people will make educated decisions for future generations.
We need to let medicine be decided the way that it always has been, which is through research, randomized clinical trials, and going through all of the processes of regulation so that doctors know how to prescribe it, how much and how often and for how long to administer it. And the only way that works is if it goes through the FDA process, not by just voting on whether or not to call something medicine.
In Washington County, Melissa Anderson, CEC News.